number of coronavirus cases rapidly increasing across the United States, health experts say the worst is yet to come, and we are still potentially weeks from the peak number of cases. With no vaccine or treatment in sight, the only hope to control this virus is that people stay home. Joining me to talk about what the next few weeks look like is disease specialist and surgeon, Dr. Azadeh Shirazi. Thank you, doctor, so much for being here with us tonight. Let's start with testing. Where are we now? We saw about a week ago complaints that we were not testing enough people. Now it seems like more drive-through places are opening. You can go to a private laboratory, get tested. Where exactly do we stand in comparison?
Well, we're doing a lot better than last week. Last week, we had enough testing kits. The problem was there was a shortage on reagents. And the tests were certainly taking way longer than, we wanted, sometimes a week, several days. The good news is on Friday, Abbott Laboratories got an FDA approval on a 5-minute test that actually doesn't need a lab to conduct. So we are going to be in better shape. Starting this week, they're going to be producing 50,000 tests a day that doesn't have to be sent out to a lab and can just be done on a machine. So this is very exciting, very good news for testing, because as you've probably heard many epidemiologists talk about this, the formula for success in beating this virus is really testing, because it serves two purposes. One, we can find these hotspots, isolate the people that are infected, but also use the testing information for surveillance to be able to track this infection and get a better grip on it than we have been without the tests available.
And you touched on something that's very unique. The coronavirus task force now saying that potentially looking forward, they're going to be looking specifically at microgeographically, if you want to say, at counties that potentially have not seen large numbers of people infected, and maybe allowing them to roll back these social distancing guidelines so that people there can get back to work, because obviously there's another factor to this, that's the economy. Do you think that where we are right now, that's prudent to move forward in that direction?
I don't think today, but I think in 1-2 weeks, as we get more of these tests out, as we better understand how this is spreading, where it's spreading, I think we're going to be able to lift the measures a little bit in areas that are not so heavily affected. We saw what happened with New York, and that's been the epicenter, and now the U.S. has more cases than any other country. We really need a little bit more time. It may be a couple of weeks until we get a better handle. But one of the reasons, we look at other countries and learn from other countries. South Korea has done really well, and part of the reason is they really relied on technology, and they've been successful at testing and then tracking where this virus is going. They've actually been using the GPS on cell phones to track those that have the virus. So we need some of these measures in place before we can really lift this movement completely from a lot of places that may not be affected yet, but they could be severely affected in 2 weeks. We don't know.
Yeah, and we're seeing just more cities really grow in their cases. Like you said, Washington, New York, were the main epicenters a week ago, even today. But then we're seeing cities like New Orleans, Miami, Chicago, Detroit completely skyrocket. And these cases are growing precipitously. What does that tell you?
Well, it tells you that the virus is moving. There's certainly movement. We saw just 2 weeks ago spring breakers coming from a lot of these cities up on the Northeast and Midwest area, heading down to Florida for spring break. We really weren't practicing the social distancing. And this seems to be a repeating pattern that we're seeing, that we don't think it's going to affect us. And then we're not prepared like we should be. And all of a sudden, we're getting, hundreds of cases, then thousands of cases. And so this is a pattern we've really seen, not just across the U.S., but globally. So we can't be underprepared. We really have to be cautious. And I know it's been so difficult with this social distancing and the effects of it on not just the economy, but our mental health and everything that goes along with it. But we really have to gain at least a couple more weeks until we have more information
It
on how to
doesn't.
handle this.
Yeah, and to your point, it doesn't seem that potentially we're going to be reopening the country anytime soon, even if the president would desire that. It may not be prudent. Dr. Fauci today saying that he estimates somewhere between 100,000 to 200,000 coronavirus cases, deaths. That is an incredibly large figure. It's not something that really provides any hope on the early stages of this outbreak here in the United States.
That's right, Maria. You're right. It doesn't provide hope, but we will be over-prepared than under-prepared because we see what's happening in New York. And I think that's just a rough estimate. That number could change dramatically in a week. If we've seen with this pandemic, things are moving so quickly, things are changing quickly. So that might not be the case, but we really aren't sure. We don't know if that's really going to be the number we're looking at.
And before we leave you, one thing that I think is very interesting is moving forward, because we've also heard that this is cyclical, that we could have a second coronavirus season just in this year alone, potentially in November. Antibody testing, it seems like that is cheaper than actually testing someone for COVID-19. A lot of people we've heard are asymptomatic. We may be carriers and not even know that we have it. But that would be interesting if we move forward and this strain remains the same, say, come November, because there would be what so many of you are calling herd immunity. What do we know about antibody testing, and where does that stand right now?
Well, it's definitely not readily available right now, but it would give us such great information because with the antibody testing, we could see who's been exposed and has recovered, who has just acutely been exposed. We can tell if somebody is exposed or has the disease but is not symptomatic. So once we get the antibody testing, we may also be able to develop some plasma therapy where we may be able to take antibiotics patients that have recovered from the disease and use it in patients that are severely ill with this disease. So there's a lot of hope for a lot of treatments, therapies, testing that would give us more information and prepare us better for a second wave of this, because you're absolutely right, Marina. We could see a resurgence of this. But, I have to say, it's heartwarming to see this country unite, become more collaborative, innovative, and more strategic than ever before during these difficult times in this crisis that we are in. We've become, we've adapted and are adapting very quickly.